Before we begin, there are a few housekeeping items to cover. This webinar is being recorded and is streaming live on Facebook. Today's session is meant to be interactive. We want to hear from you. To do this, put your questions in the chat box for those turning in via Zoom and in the comments on Facebook. Thank you to those who have already sent in questions. Dr. Block will be answering them shortly. Finally, if we're unable to answer all of your questions, we will send out a follow-up email with answers. Facebook listeners, check the comments for instructions on how to send us your email to be included. Community Connections is brought to you by the American Lung Association and proudly presented by Memorial Healthcare System and Memorial Cancer Institute. We will now watch a brief video and then I will introduce our speaker.
Anything we can do to lower the risk of someone dying from lung cancer is a big deal. It's a really big deal. And in terms of that, screening is the best chance we have. If it's caught early, lung cancer is a very curable disease. A low-dose CAT scan is effective in reducing the death rate from lung cancer by about 20%. That's a huge number. Your risk of lung cancer is higher if you are a smoker. If you're a former smoker, you quit, say, 5 years ago, you're still at elevated risk for lung cancer. Once you get to around age 55, then you start seeing the increased risk from a lifetime of smoking. Of course, the other component to screening, which I need to make sure I mention, is smoking cessation. Those two really need to go hand in hand. Most insurance companies now do cover a lung cancer screening test if you meet the criteria, and that includes Medicare. If you're a smoker, if you're at increased risk for developing lung cancer, please come in and get your lung cancer screening test. It may save your life.
Thank you. Dr. Mark Block is the Chief of Division of the Thoracic Surgery Program at Memorial Healthcare System. He has practiced general thoracic surgery since completing his residency in cardiothoracic surgery at Barnes Hospital in St. Louis in 1997. He received his undergraduate and medical degrees from Yale University and completed his general surgery residency at the University of Chicago. He also received fellowship training in surgical oncology at the National Cancer Institute. Before coming to Memorial Healthcare System, Dr. Block practiced general thoracic surgery as an assistant professor of surgery at the University of California, San Francisco, and then at the Medical University of South Carolina, where he was also the director of the Thoracic Oncology Working Group. Dr. Block holds certifications from the American Board of Surgery and the American Board of Thoracic Surgery. He is a fellow of the American College of Surgeons and the American College of Chest Physicians, and is a member of the Society of Thoracic Surgeons, the Southern Thoracic Surgical Society, and the General Thoracic Surgery Club. He has published more than 43 articles in peer-reviewed journals and has been an invited contributor to several authoritative textbooks on thoracic surgery. Thank you and welcome, Dr. Block.
Thank you very much. It's a pleasure to be here. And I'm really excited to talk about this topic. There's a lot of myths and facts and fiction around it. So let me share my screen here and we'll get started. And we do have some questions and I'll take those at the end. So I'm hoping you can all see my screen now. The idea here is that vaping has become an epidemic, certainly among our youth. There's a lot of information out there, there's a lot of misinformation out there, and we thought that now was a really appropriate time to try and address some of those issues. So hopefully at the end of this, you'll have a much better understanding of vaping and its consequences. Now, I'm a big believer in data, and so I want to start by discussing some definitions here. What do we mean by vaping? Vaping, and this is the definition from Merriam-Webster, means to inhale vapor through the mouth from a battery-operated electronic device that heats up and vaporizes a liquid or a solid. Now, we often think about that as an e-cigarette. The abbreviation is often ENDS, which stands for Electronic Nicotine Delivery Systems. But we've also seen in recent years some counterfeit devices that allow people to vape THC, or the active component of marijuana. We're going to be focusing primarily on the nicotine-based e-cigarettes. I wanted to start by just exploring the scope of the problem. because we do believe it's a problem. On the left is some study from the Pew Research Center showing a rising number of college students and high school students from 2016 to 2018, really creating an epidemic in youth vaping. The National Youth Tobacco Survey is done every year by the Centers for Disease Control and Prevention. And at their last survey in 2021, of course, accounting for some of the COVID effect, there were 2 million current users estimated in our high school population. 11% of high schoolers were actively vaping and 3% of middle schoolers. So this is a big problem amongst our youth, and one with which the American Lung Association is very concerned. How many adults regularly vape? Well, this survey, which was published in the JAMA network from 2017 to 2020, shows the number of current vaping e-cigarette users versus the number of daily ones, and the ratio of daily to current. In other words, current is defined as somebody who has used it in the past 30 days. Daily is somebody who uses it every day. And you can see the number of daily users has steadily increased from the 2017 numbers to the 2020 numbers. The number of current users is about 5% of the adult population. That's a very large number. If we look by age category, you can see that the younger members of our society are the ones more likely to be vaping. The prevalence here is around 15% of people below the age of 25. An interesting statistic here, though, that I think we need to be very proud of is that the proportion of people under the age of 20 who are actively vaping declined between 2018 and 2020. Now, as you may know, in 2019, the American Lung Association started a very strong campaign against youth vaping. There's been a lot of progress in that field, and I think we're starting to see some results. There's still 15% of our youth are vaping, but the numbers seem to have come down slightly, which is very good news. I want to cover 4 myths. Number 1, vaping is just inhaling flavored water vapor. Number 2, vaping is actually helping us to quit smoking. Number 3, it's actually safer than smoking cigarettes. And myth number 4, vaping doesn't cause people to start smoking cigarettes. So I want to start by highlighting this particular study that was published by the National Academies of Sciences, Engineering, and Medicine and presented to Congress. This is a very well-referenced, highly data-driven report, and I'll talk about it periodically during this presentation. It really analyzes the data very, very effectively and comes to lots of conclusions. One of the things that's important to understand is we're dealing with science here. We're trying to answer these questions with science. We want really good, high-quality science. An anecdote, my friend quit smoking by using a vaping pen. That's a very nice anecdote, but it's not scientifically very helpful. It doesn't really help us understand what happens in the broader population. Ideally, we'd like to do a randomized trial where half the people are randomized to one treatment and half the people are randomized to the other. That's the highest quality of data. But unfortunately, we can't do that anytime we want some information. So we have to try and get data from all different sources. And this particular report kind of evaluates the quality of the data and coming up with some conclusions. And so we'll see that during the course of the presentation. So number 1, vaping is just flavored water vapor. That's all, not a problem. Well, that's really not true. First of all, it's not a vapor. Vapor is what you get, like if you boil water and steam, you get water vapor. You can't see a vapor. Vaping is actually breathing in an aerosol. These are particles that are suspended in air. That's why you can see it, because it's a particulate suspension that you are inhaling. So you're inhaling an aerosol, and that aerosol contains lots of particles. The base is usually propylene glycol or vegetable glycerin. That's what most of it is made of. But as you'll see, these aerosols contain a lot of other components, toxins, metals, other chemicals, and these are unregulated in terms of their contents and their safety. So from one manufacturer to another, from one liquid to another, from one counterfeit to another, there are a wide variety of chemicals that can be found in all of these aerosols. Almost all of them contain nicotine, and nicotine addiction, of course, is one of the main problems with vaping. So this paper was published in 2013, very early on, looking at some of the things that are contained in the aerosols. These e-cigarettes have a heated filament that's made out of metal, and those metals wind up in the aerosol. They found silver, nickel, I'll turn on my laser pointer. Silver, nickel, iron, aluminum, chromium, and tin, as well as silicate particles. And in fact, 9 of the 11 particles that were found in e-vaping aerosols are actually higher than you find in cigarette smoke. This is because these devices have these metal filaments that cigarettes don't. And many of these are known to cause respiratory disease. In fact, you can find formaldehyde, which is a known carcinogen, in the aerosol of e-cigarettes. This is an interesting study that was published in the New England Journal of Medicine in 2015, where they looked at the amount of formaldehyde found in cigarette smoke here, and the amount of formaldehyde reported in the gas phase of e-cigarettes. In other words, the vapor portion of the e-cigarettes, very, very low. But what they did is they actually said, well, what about in the aerosols? Is there formaldehyde in the aerosol? And when they used the e-cigarettes at a low voltage, there was not very much. But if you turn up the voltage, which you can do as a user, you can increase the voltage on these devices very easily. Turn up the voltage and you get a lot more formaldehyde in the aerosol of an e-cigarette than you do smoking a regular cigarette. And we know that formaldehyde is a cancer-causing agent or a carcinogen. What about other toxins? Well, this is a pretty thorough publication in 2020 that looked at lots of different things. First of all, it contains these solvents, propylene glycol or vegetable glycerin, that are aerosolized. Now, I put an asterisk here to note that the FDA considers these as generally recognized as safe. Generally recognized as safe means you can eat it and it's probably not going to cause you any harm. That's eating it. That's not inhaling it as an aerosol or a vapor. We really do not know the safety of these chemicals when they get into your lungs as an aerosol. So the concept that they're generally recognized as safe really doesn't apply when we're talking about inhaling them into your lungs. We just don't know. Flavorings. There are thousands of flavorings on the market, and there are more every year. Each flavor is a different flavoring or a combination of flavorings. And although most of these are generally considered as safe, that's safe for consumption, not for inhalation. And some of them are actually known toxins. For example, polysaccharides can be converted by the vaping device into furans and aldehydes, which is a fancy name for chemicals that we know are cancer-causing chemicals. Benzaldehyde, which is found in the cherry flavors, is also a cancer-causing agent. And cinnamon flavors has the cinnamaldehyde, which is another cancer-causing agent, and that's found in more than 50% of the flavorings. These are known to be cytotoxic. Ultrafine particles, those are really, really tiny little particles that you really can't see, but they're so small that they actually can work their way through the little parts of your cell, in between cells, and penetrate deep into the respiratory tract. There are literally trillions of them in one vape. There are fewer than there are in a regular cigarette, 10 to the 10th as compared to 10 to the 12th, but that's still a very high number. And these are known to be associated with cancer, cardiovascular disease, epigenetic changes, which means they get into the actual DNA and change the DNA, which is one of the things that leads to causing cancer. Aldehydes like formaldehyde, acetaldehyde, and acrolein are known components in vaping aerosols, and these are cancer-causing agents. The concentration, as we saw in that previous study, is dependent on the power settings of your device. PAHs are hydrocarbons, which are also known to be toxic and carcinogenic. They come from the combustion products. There are more than 500 in cigarette smoke, and although they are lower in e-cigarettes, a lot lower in e-cigarettes, they are still present in e-cigarettes. And as we saw in the previous slide a few slides ago, there are metals that are found in e-vaping aerosols. These include chromium and nickel. Those are not found in regular cigarettes, and those are classified as cancer-causing agents or carcinogens. Cadmium is another cancer-causing metal. It is lower in e-cigarettes than it is in regular cigarettes, but it accumulates in the lungs, so it's a dose over time effect. So myth number one, it's just flavored water vapor. Well, I think we pretty clearly busted that. It is not. It is an aerosol, and it contains a lot of compounds, many of which are known to be cancer-causing agents. Myth number two, vaping helps smokers quit. So here's this report that was presented to Congress, and they said that there was moderate evidence that an e-cigarette with nicotine is more effective than an e-cigarette without nicotine. That's no surprise. I mean, nicotine is the addictive agent in cigarette smoke. So it would not be a surprise that something with nicotine is better than something without nicotine. There's limited evidence, meaning not so really great evidence, but maybe, that e-cigarettes may be effective to promote smoking cessation. But the key here is there is insufficient evidence about the effectiveness of e-cigarettes as a smoking cessation aid compared with no treatment at all or to FDA approved smoking cessation treatment. So let's talk about some of this stuff. First of all, this is an example of where there's a lot of studies out there. You can find pretty much whatever you want, but the vast majority of them are very low quality. This is a study that was published in 2017. And as of 2014, they found 150 different reports in the literature. And they just went through and said, this supports it, this doesn't, and came up with a number. But this is meaningless because these studies, for the most part, are very low quality data. We just can't rely on this kind of information to guide us. What can we do? Well, we can look at all those studies and be a little bit more selective and choose the ones that seem to be a higher quality data. This was a French report published in 2016, where they did an analysis that looked at 11 observational studies. In other words, we interviewed people over time and just saw what happened. And they found that really none of these 11 studies were convincing in terms of e-cigarettes as effective in helping people quit smoking. They found 2 randomized trials, this one in 2013 and this one also in 2013. And then this is a Cochrane database review of these 2. Basically, they put together these 2 studies and came up with a conclusion and said, look, the quality of the evidence is really low, and there's really no evidence that against a placebo, in other words, nothing, using e-cigarette compared to nothing, is any better to help people quit smoking. This study is interesting to look at. They randomized people into 3 different groups, a nicotine cigarette, a nicotine patch, and a placebo, and looked over 26 weeks here. This is the curve showing the proportion of people who were abstinent from smoking. The blue line is the e-cigarettes. The green line is the placebo, in other words, nothing, the e-cigarette with no nicotine. And the red line are patches. Looks pretty promising here early on, but out here at 26 weeks, there was really no difference. It was about 7% compared to 6% between the nicotine patch and the nicotine cigarette. P-value of 0.46, that's a statistical measure, means that basically it's like flipping a coin, 50%, whether you were going to get this result or not. We like to see numbers here less than 0.05 to find something that we consider statistically significant. So this randomized trial really came up showing no difference between nicotine cigarettes, placebo, and a patch. A Canadian review in 2019 looked at a number of studies and said there was no evidence to support e-cigarettes as an effective smoking cessation aid. It was inconclusive. And then this trial was published in the New England Journal in 2019, a British trial out of the UK, prospective randomized trial. They randomized people to an e-cigarette or a nicotine replacement therapy. Both groups got weekly counseling to help them quit smoking, and then they looked at 52 weeks to see what happened. In the e-cigarette group, more people were abstinent at 1 year than in the nicotine replacement group, 18% versus 10%. And this difference was statistically significant. This is the kind of what we use from a statistical standpoint, because this number is above 1. That means there is a statistically significant difference. So this seems to support that an e-cigarette is helpful. The problem with this study, and there were several, was that of the people who were using nicotine cigarettes, 80% of them were still using the nicotine cigarettes at 1 year. They were still addicted to nicotine. The other problem is that in the real world, when people talk about using e-cigarettes to quit smoking, they don't go to counseling. So it's not reflective of what's happening in this study. And the other problem is that the control arm was nicotine replacement therapy with a patch and was not using the medications that are known to work, varenicline or Chantix and bupropion. In randomized trials, the abstinence rate with these medications is as high as 26%. So you're probably better off, we know you're better off, using approved, FDA-approved methods to quit smoking than you are using e-cigarettes. So does it help smokers quit? Well, there's a lot of data out there, not very good quality data. This is a scene from one of my favorite movies, 12 Angry Men. The jury is still out, and it will take time, But so far, the evidence tells us e-cigarettes do not help people quit smoking. Myth number 3, vaping is safer than smoking cigarettes. A lot of data here. The congressional report said that it is conclusive evidence that substituting e-cigarettes for combustion cigarettes reduces a user's exposure to toxicants and carcinogens that are present in tobacco smoke. So is it safer than smoking cigarettes? I think what we need to say is it less toxic. That's probably a better word. Is it less toxic than smoking cigarettes? Because we know it's not safe. Well, there is substantial evidence that actually switching from a regular cigarette to an e-cigarette, completely switching, does reduce short-term adverse health outcomes in several organ systems. So maybe, let's look at some of the evidence. The problem, there are a lot of unknowns with vaping. As we've seen, the way somebody uses their vaping pen or their e-cigarette has a lot to do with the amount of toxins they're exposed to. From device to device, from refill to refill, from user to user, even from puff to puff. The other thing is that they've only been around for 10 years or so, so we really do not know what the long-term effects are. Back to this toxicology paper, these are all different agents that are found in e-cigarettes, and they're associated with symptoms like allergies, emphysema, inflammation, systemic inflammation. Many of these are higher in patients or in people who use e-cigarettes. It does not seem to affect things that look like systemic inflammation, however. What about reactive oxygen species? Everyone's really worried about reactive oxygen species and oxidative stress and peroxides and so forth. Well, reactive oxygen species are present in the aerosols of e-cigarettes. And in fact, if you increase the voltage, you can increase the reactive oxygen species by more than 8 times. And in fact, there is evidence that the aerosol use actually causes the lung itself to produce more reactive oxygen species. These are biological chemicals that are produced in the body in reaction to oxidative stress, but they can also cause oxidative stress. And vaping triggers programmed cell death, which is a reaction to exposure. Now, EVALI or e-cigarette vaping associated lung injury was something that showed up in 2019. People were coming into the emergency room and presenting with this. There were several thousand people, almost 3,000 people, and 68 deaths associated with it. It was ultimately linked to an additive that was found in the THC products, not in the nicotine products. And in fact, by the end of 19 and early 2020, the number of people presenting with this disease has pretty much gone away. So a summary of the known effects compared to tobacco smoke here. Tobacco on the left, you see e-cigarettes, lots of bad things in cigarette smoke, bad things in the e-vapor, although maybe not quite as much. So a lot of unknowns about the effects on the lung. Is vaping safer than smoking cigarettes? Well, I want to remind you that it wasn't that long ago that cigarette smoking was considered safe. These are ads from the 1930s and 1940s. Your doctor, your dentist is recommending smoking. And look, your doctor smokes Camels. And here's even a medical specialist reviewing cigarette smokers and saying, look, there are no adverse effects. This wasn't that long ago. And this was after people have been smoking for 20, 30 years. It wasn't until the 1950s and 1960s that we started to see this rise in deaths from lung cancer associated with cigarette smoking. Look, back here in 1930, dying from lung cancer was rare. And that's when everyone thought cigarette smoking was safe. Well, in the 1960s is finally when we realized it. Luther Terry, the Surgeon General, published in 1964 saying cigarette smoking causes cancer. It took a long time for us to recognize that connection. And we're only now just getting experience with e-cigarettes. So is it safer than smoking cigarettes? I'd say it's not safe. Is it less toxic than smoking cigarettes? Maybe. I think the jury is still out because we really don't know the effects of all of these toxins on the lung. We just don't know. And that's the problem here. Myth number 4, does it lead to smoking cigarettes? Well, again, this congressional report said there was substantial evidence that its use increases the use of tobacco cigarettes. And amongst the youth and young people, who there's moderate evidence that using e-cigarettes actually increases the frequency and intensity of subsequent tobacco use. There are lots of studies. So what they did is several people put together a meta-analysis, which means let's look at all these studies, take all the people and combine them all together. And what do we get? Here's one that looked at 9 studies in adolescents and the youth and said, if you never used an e-cigarette, your probability of smoking is about 7%. If you've used an e-cigarette, your probability is 23%, highly significant. Here's a result. This is the way the numbers play out. Anything to the right of 1 means there's a high association between using e-cigarettes and smoking. You can see these numbers are very far away from 1. Here around 3, the risk was 3.5 times. Another meta-analysis, this one using 17 studies, same thing. All the numbers are to the right of 1, an odds ratio of 3 times the risk if you use e-cigarettes as using smoking. And a third meta-analysis published in 2020 done in Ireland, same thing. Here it found a risk 4-fold higher of those who used e-cigarettes going on to smoking cigarettes. The challenge here is that these studies really show a correlation. There's a strong correlation between e-cigarettes and subsequent cigarette smoking. What's really unclear is there a causal connection? In other words, are e-cigarettes a gateway into cigarette smoking? Or these are people who have genetics or an environmental factor that would increases their likelihood of using both e-cigarettes and cigarette smoking. And that causal link hasn't really been established, but there clearly is a very strong connection. So does it lead to cigarette smoking? Again, I think the jury is still out. So we covered the 4 myths. I hope you now have a little bit of scientific understanding of them to help you better just have this conversation and understand the problem. I would point out that the American Lung Association has come out very strongly against vaping. E-cigarettes and vaping is a problem, and the American Lung Association is concerned that we're at risk of losing another generation to tobacco-caused diseases as a result of e-cigarettes. No amount of vaping is safe. Aerosols contain toxins that we know cause acute lung injury. The long-term effects are unknown and are very likely to be bad. And of course, e-cigarettes promote nicotine addiction. So I appreciate your time. Thank you very much. We have a few minutes. Several people did submit some questions, so I'm going to go through some of these real quickly, and then hopefully there's some other questions. So Jennifer asked about resources. There's some great resources available online. The Lung Association has some, as well as the CDC. And I think what we can do is probably post that in the chat, some links. Does vaping create the same issues as secondhand cigarette smoke? Well, we don't know for sure. We do know, in the studies that looked at this, that the aerosols and the chemicals in the vapor from an e-cigarette do contaminate indoor environments. So if you're in an indoor environment with somebody who is vaping, you are being exposed to the same chemicals that they are. This is an interesting question. Is vaping THC a positive alternative to smoking flower THC for pain management? Would you recommend vaping for patients who are having pain management or anxiety concerns? I think the short answer is no. And I think the answer to that question is that vaping is not safe, no matter what's in it. We know the aerosols contain chemicals and toxins that are harmful. Now, is it safer or less toxic than smoking a marijuana cigarette? Again, we don't have the answer to that. But there are specialists in palliative care medicine who are excellent at helping people with chronic pain management using techniques and medications and approaches that we know are safe. So I would certainly not recommend using vaping THC as an alternative. As a parent, what's the most effective thing I can do to help my 16-year-old son quit vaping? Well, if you have the secret of how to motivate an adolescent to do anything, then you should write a book. But what we do have is a link here to the American Lung Association, which has a lot of resources for helping teens, support groups, information, even teen-oriented groups and groups that are run by teens to help fellow teens quit vaping. Why does vaping cause popcorn lung while cigarettes do not? Why is flavoring allowed? Well, popcorn lung is a symptom called bronchiolitis obliterans, and that's associated with a chemical that was found in making popcorn, and so workers who worked in these popcorn facilities got it. It's called diacetyl. Diacetyl is in the aerosols in e-cigarettes, but it hasn't really been seen in people who vape. And that may just be a dose phenomenon. There are a few cases of it, but it has not been the pandemic that people were concerned about. The other thing to remember that this question brings up is that e-cigarettes are not FDA regulated for safety or contents. They are regulated as tobacco products, which means they just need to report what they put in them. There's no regulation of consistency, dosing, safety, none of that. So they can put in flavors, whatever they want. There's no regulation that says they can't. And then a couple more questions here. Does vaping affect lung nodules? Do you have any studies about damage over time? The short answer is no. We don't know the answer to that. It hasn't been around long enough. This is an interesting question. What measures are taken during manufacturing of safe medication inhalants to prevent intoxication or unintentional overdosing? What's the real difference between vaping and an inhaler, humidifier, or nebulizer? The real difference is that these are FDA regulated and controlled medications. The amount of the medication and the exact contents and the dose are very carefully regulated. So when you use these, you know exactly what you're getting. You know the drug that you're getting, and that drug has been studied extensively to know the effects of that drug. When you're vaping, you don't know what you're getting, you don't know the dose, and we have no idea what the long-term effects are. And that kind of answers this last question. What exactly does vaping do to your lungs in the long run? Short answer is, we don't know, but it's very likely to be bad. So with that, I will conclude. I hope we have a few minutes. I think I ran a few minutes over, but I'm hoping that answered a lot of the questions, and I'm available to take on any more that may have come up. Ali?
Hi, Dr. Block. Thank you so much. Actually, we are right on time. It is now 12:31, so we went over by 1 minute. But if you have questions, please feel free to submit them either on the chat or Facebook, as I mentioned before, on the messenger. And then we will get back to you. So thank you for attending today's American Lung Association's Community Connections event. Memorial Cancer Institute and Memorial Healthcare System are proud to partner with the Lung Association to bring educational series such as this one to our local community. For the questions we've been unable to get to today, we'll be on the lookout for an email coming up in the upcoming week with the responses. To learn more about vaping, including available free program support groups and resources, please visit www.lung.org. Also, don't forget to follow the South Florida American Lung Association on Facebook for announcements regarding our next Community Connections event. Follow us at Lung SOFLA for details. And until next time, thank you, Dr. Block, and all of you who tuned in today. Together we can improve life one breath at a time. Have a great day.